Minister, I note your announcement that you are proposing a task force to deal with waiting lists, and that you have put in a funding request for a budget allocation, hundreds of millions of euro, to pay for this multi-year plan. Wonderful news, Minister. Again, we can find emergency money to outsource waiting lists, yet we cannot find the money to support expansion within our own hospital settings. Can I speak about the Regional Hospital of the South East, which is University Hospital Waterford, a Model 4 hospital that is servicing a catchment of approximately 520,000 people. A hospital that continues to be the least resource Model 4 in the entire country. And to put that in context, UHW, with its 520,000 patient catchment, receives 194 million annual funding. University Hospital Limerick, by contrast, with a catchment of 400,000, receives annual budgets of €266 million. 72 million budget deficit for a hospital providing exactly the same services and to a smaller patient number. What is this additional 72 million paying for in Limerick, Minister? Well, certainly a portion of it is paying for the additional 865 whole-time equivalent employee positions the hospital enjoys over the hospital employee number allocated to the South East and Waterford. I often hear deputies in the House describing the funding deficits at University Hospital Limerick. And if that is the case, which I'm sure it is, what does it say about the treatment of the main regional hospital of the South East? You have long been aware, Minister, of the extensive waiting lists that have been a feature of University Hospital Waterford's treatment landscape. Record waiting lists nationally in cardiology, ophthalmology, endoscopy, elective trauma, colorectal surgery, and the list goes on. In fact, national media reported last year that UHW waiting lists were ranked third worst in the country. And what has been the response of the Department of Health in the interim? Did you decide to revisit the budget issues, to examine the efficiency metrics in terms of procedures completed per euro spent in this hospital, which ranks amongst the best in the country? Did you decide to provide additional funding and approve whole-time equivalent positions to consultant staffing, specialists in general nursing, radiography and lab technicians to build on the capital efficiency of this hospital? The answer is no. Not you, not your department, not the HSE, not South West Hospital Group. Instead, you found money from national treatment purchase funds to begin targeting South East patients for treatment options in Cork and Dublin private hospitals. Most galling of all, Minister, the significant rescue provided to the cardiac service during COVID, where UPMC installed a new lab system. But no sooner did the resumption of procedures happen in UHW that an NTPF contract was drawn up which bypassed the UPMC facility in favour of sending vulnerable cardiac patients over 80 and 120 miles to Dublin or Cork to have cardiac diagnostic procedures completed. Less than half the people selected on this list took up that option, Minister, which clearly shows that medical management are totally out of touch with the needs of people to have these procedures in their own regional hospital where they regularly attend. The issue of waiting lists has always been a component of poor capacity, staffing and recruitment issues, available theatre and diagnostic space and the ability of patients to attend appointments. Many of these factors are solvable by increased health resourcing. This is the status that private hospital concerns have to reach to remain commercially viable, and that is why they, as opposed to public health systems, can offer a solution to low-level elective procedures. For many of the patients that your new initiatives will target, they will just move from one waiting list to another, Minister. Having received one future procedure, their care plan and management will likely still fall back on the regional hospital for which they attend. Money will not solve the waiting list problems, but will only dampen them for a number of months. Your recent talks, Minister, of looking at new elective hospitals in Cork, Dublin and Galway tells me that you are deciding to continue to give those who have much more, and in so doing you will continue to embed health inequity and waiting lists within our public health system.